the treatment options for prostate cancer, which I don't think they do for any other cancers, is what they call watchful waiting, or what you call also active surveillance. Is that still kind of in vogue and something that they're doing?
It is, very much so. It's very important to understand the difference between watchful waiting and active surveillance. They're used interchangeably, but they don't mean the same thing. In fact, active surveillance is used a whole lot more now than watchful waiting. Watchful waiting means you get diagnosed with prostate cancer. We don't need to do anything for that cancer, and we will only treat you if the cancer gets worse.
And why would we not want to do anything for that cancer? Because
it's low grade. There's a lot of evidence. There's a preponderance of evidence showing that most men with prostate cancer should not get treated for prostate cancer because they won't die from it. They will likely die with it. So
because it grows slowly and it's diagnosed later in life in general.
Correct. Okay. Correct. So it grows slowly. Those are the Gleason 6s in terms of that grading system that there is for prostate cancer, sometimes even Gleason 7s. And it depends on comorbidities, meaning what else do they have? Are they going to die from a heart attack before they have prostate cancer? So they should be on active surveillance. Watchful waiting implies we do nothing because it's a low-grade disease. We'll do something only if it gets worse. Active surveillance is closely monitoring that patient with PSAs every 3 to 6 months, perhaps MRIs of the prostate, and a subsequent biopsy, so that we can, if it's getting worse, we can get it before it really starts getting bad and spreading, and we can treat it with curative intent.
Does that mean they're biopsying every 6 months? Because isn't there risk associated with those biopsies?
That's a phenomenal question. I'll tell you why. The protocol that most practitioners have is biopsying every year on men on active surveillance for about 2 to 3 years. Recent data now shows that you can wait up to 2 years because there's no difference in doing a biopsy in 1 year or 2 years after that initial diagnosis.
And as long as the PSA is not significantly changing.
Correct. You can wait up to 2 years unless there's a significant jump in the PSA test, suggesting that there's some movement of the cancer, so then you want to do it sooner.
So is there ever, and some people, you get diagnosed and you go, I want this out of my body, right?
Correct.
So is that, when do you consider to take a more aggressive approach to getting your cancer out of your body, even though you may qualify for watchful waiting? And what would be the next step?
There's always a psychological component to the diagnosis of any cancer, right? Is the big C word.
Right.
So there's a psychological component where people are now more anxious because they have this thing in their body. Unfortunately, there's another segment or element where some institute like the United States Preventative Task Force is saying, well, we shouldn't screen too much. Why are they saying that? Because once you start screening and if you find something that's low grade in the person's psychology, in their mind is still prostate cancer, it's still the C word. Right. So it causes some anxiety. Everybody's personality is different. I have many patients who are on active surveillance, which we put them on a lifestyle plan called the capless method, and that's a system, a science-based system, so that they live a lifestyle, so that they don't have to need some sort of surgery or other treatment. So
in general, though, watchful waiting, active surveillance is an effective treatment for many men.
Absolutely, backed up by major studies. Right. So that's the other question that I think patients need to ask. Am I a candidate for active surveillance? Why? Because, why should the patient ask? The patient should ask because, number one, they might be. And if you don't ask the right questions as a patient, you're not going to get the right answers. The reality is that every surgeon wants to do surgery. Every radiation oncologist wants to do radiation. I mean, if, this concept of you have a hammer, everything looks like a nail, there's some element of that, and not every doctor is going to say, oh yeah, you are a candidate for active surveillance. It's not one of the things that they would say. Some would, and I know many that give them all their options, including active surveillance. Others won't. So the man or the patient needs to ask, am I indeed a candidate for active surveillance?
All right. Ask the question, and then trust the stats.
That's right.
Thank you.
You're welcome.
If you liked what you just saw, we have a whole lot more with Dr. Geo Espinosa at our website, bottomlineinc.com. And do me a favor, share this, tell your friends. We have so much great information. Come to bottomlineinc.com.